conversation is proudly brought to you by the National Center for Wellness.
Hi, I'm Dr. Rob Coombs, founder of the National Center for Wellness and host of the Childbirth Summit. I'm thrilled to welcome you to another amazing interview. This one is about the mind-body connection and the intimate time and bond shared between mom and baby just after birth. It's my pleasure to welcome Barb Morrison. She's PhD and a certified nurse midwife. She's the associate professor in the Janice M. Reardon Distinguished Professorship in Maternal and Child Health, with an emphasis in breastfeeding and human lactation at Wichita State University School of Nursing. She maintains a mission to advocate, educate, and inspire healthcare reform to enhance physiological and ecologically appropriate care for the mother and newborn dyads, especially as it relates to the establishing breastfeeding, frequent kangaroo care, and holding an optimal attachment with the baby. Dr. Morrison's research interests include the impact of breastfeeding and kangaroo care on the neuroendocrine development of the newborn and the parents, and implementing best evidence-based breastfeeding and attachment practices in hospitals, birthing and postpartum units, and in the community. Dr. Morrison shares her research and passions through presentations, writings, radio shows, and her website, which is listed below at drbarbcnm.com. So it's my pleasure to welcome you to the breastfeeding and to the childbirth conversation. How are you doing today?
I'm doing fine. It's great to be with you, Rob.
I love it. You're great. I look forward to breaking down psychoneuroendocrine for everybody and to explaining a little bit about...
afraid,
Can I tell you, it's something that everybody knows about, but they don't know it like that. And
right.
After our conversation today, they'll have a much better grasp of what it really means. It's great. And I'm interested in getting into talking about kangaroo care with you. But before we do that, the professorship that you hold at Wichita State, can you talk a little bit about the position and about Janice Reardon a little bit, just to explain to everybody listening?
I'd be happy to, because it's a big honor. Jan Reardon, I consider one of the mothers or maybe grandmothers now of breastfeeding, and particularly breastfeeding within nursing and as lactation consultants and things of that nature. She started early on as she was having her children. She had 6, I believe it was. The last set was twins, which she tandem nursed. But, and she just had her 80th birthday. So we're talking back in a time when breastfeeding really wasn't the thing to do. But she was very key in getting the Leche League groups going here in the state of Kansas. And then took her passions into the education field. She was a faculty member at Wichita State University for about 23 years. Also president of the International Lactation Consultants Association, and I'm sure a number of other things. But Jan is probably best known for this book.
Yeah.
She's now not the first editor anymore because she's retired. But this book on breastfeeding and human lactation is really kind of the Bible, so to speak, for lactation consultants. It's a book that's used for preparation for that, and a textbook for most anything. The 5th edition just came out in November. I do happen to have 2 chapters in here.
Awesome.
But not on the psychoneuroendocrinology.
We'll have to wait for that.
I have one on breastfeeding education and the women's health issues related to breastfeeding.
Awesome.
So those are kind of what was left when I got here. Jen said, "Do you want to do these?"
Gladly. That's great. Yeah, it's amazing. You say she's 80. You go back and you start doing the math about, you say breastfeeding wasn't done because you think 80 years ago probably was done all the time, but her kids were probably born in the 60s.
Right.
I have no idea, knowing her life history like that. But it's sad to know that was the point where we started to deviate from normal.
Right. And, it's amazing to me, though, how many people continued to work through that time. I mean, I'm the oldest of 5. I'll give it away. My 60th birthday is coming. So 60 years ago, mid-50s, mid-1950s, my mother breastfed me, and I'm the first of 5. She breastfed all 5 of us.
Good job, Mom.
And it was such so normal to me, I didn't realize until well into my nursing career that we had shifted away from breastfeeding as the primary way of feeding. And I continue to meet moms who did breastfeed, many of them for a long time, probably all could have made good La Leche League leaders from the get-go. But it certainly is nice to know that there was a core of moms who said, I don't care what is happening out there, that breastfeeding is the best for our kids, and so I'm going to do it.
That's awesome. And to hear, stories about women who did it the right way, especially doing it despite recommendations or things they were being told. I think that's fantastic. So
Yeah.
good. I'm glad to hear your mom did that. Take me to the book for a second. You said
Okay.
your two chapters. It's about women's health education. What was the first chapter about?
The first chapter is on women's health and breastfeeding. So it goes through um, all of the contraception, large section on lactational amenorrhea, i.e., not having a period when you're breastfeeding enough to keep the hormone levels up that you don't get pregnant.
Okay.
And then I cover a number of both immediate or acute and chronic conditions, illnesses that are related to pregnancy, as well as things like lupus, seizures, other chronic disorders that can impact pregnancy or which pregnancy may impact.
Okay.
Yeah. So, and that chapter I did have help with from Karen Wambach, who's one of the editors, just because with research going the way it is, we keep knowing more and more and more. It's like, when do we stop in this chapter? And I know next time the book gets revised, we'll have to put in some things, conditions or how breastfeeding helps to prevent or decrease the risks of heart conditions. I know cancers, particularly breast cancer, is mentioned several places in the book, but depression and some other things are up and coming research with relation to breastfeeding. And so it's going to be ever changing, but it's exciting to know that so much more is being linked to breastfeeding, and that when we breastfeed, it's not only benefiting the baby, it's benefiting mom.
Yes.
And in amazing ways. So
Talk a little bit more. Can you talk about some of the amazing things for mom?
um, sure. Well, we definitely know that moms who breastfeed have a lower risk of breast cancer. And part of that is because their breasts in breastfeeding fully develop. Um, our breast gland that isn't fully developed at the time of birth. And so we have a little bit of breast tissue when we're born, and then during adolescence it gets bigger. But it isn't until mom gets pregnant that the breasts really come to their full development. And part of that happens with the hormones of pregnancy. So that's one thing. One of the other things that has found, and they've linked to breastfeeding, and I will say, I think a lot of it is also related to touching and holding of the infant, is the decreased hypertension and decreased cardiac problems. And that is associated with the fact that as mom is breastfeeding, she has that wonderful hormone oxytocin that increases, but oxytocin helps with relaxation. And for both moms and babies, the set point for stress is lowered, which lowers the risk of any illness for both moms and babies, and doesn't cause things as greatly as the cardiovascular diseases. Diabetes is another one. They're still not quite sure where they are with that and how much it might help. It certainly will help with newborns because it helps to set the appetite control in our brains so that infants won't eat as much. It has, and that set point is an epigenetic, that's an interpretation of the genes, that's happening up there that helps. So, for our infants, we know that it will help decrease their risk of obesity. For moms, the breastfeeding can help to take off some of that weight after birth. The research is a little iffy on how much that happens.
Well, I would understand that if you are breastfeeding, you are triggering a different metabolic pathway in the body.
Right.
And so you are initiating a normal response post pregnancy, and it's a normal change in the body to have to put on the weight to be able to hold a baby, to support and grow a baby. That the process would be able to unwind itself naturally as much as it wound itself. So it makes logically, I don't think there's a question about it. Whether we were able at the point to be able to describe the biochemistry and the pathways may not be there, but
yeah. Well, and for some women, my sister being one of them, she lost so much weight with her first child breastfeeding that she had to, I don't know whether she had to stop or at least step back because she just couldn't eat enough to keep her body able to make it. So it's one of those things. I just consider this whole process so amazing, how we were made and the fact that we interact, and the beauty of what I've been learning in all of this is just how important it is to keep mothers and babies together.
Absolutely.
Now, one of the other things and that I'll mention as far as what helps with moms is that moms who are breastfeeding, and again, I think it's this lowering of the stress levels, may end up with postpartum or peripartum depression. However, it is not as severe.
Okay.
So, again, it's that hormonal cycle, and if we can get into it and help keep some of the hormones high, then for whatever reasons, everything else kind of calms down. So if you appreciate in general, I think the overall issue is that in general, if you appreciate that for moms, stress is the key thing for leading to inflammation, which leads to illnesses. And when moms are holding and nursing babies, their stress levels decrease. And as I said, reset the set point, so to speak, so that they can, it just helps with their health overall.
Absolutely. So everything is run off of, I like to use the term of thermostat, and that you alter the thermostat, and that thermostat triggers a release in the maintenance of different hormones or chemicals in your body at a different level or a different rate, but most of it naturally is triggered by the connection or the bond between mom and baby.
Right.
I always like to add that it works really well for dads too, and I always want to empower dads to get in there and be involved and make those connections because they get the same benefit. But,
that's one of the things that I think, and even older societies probably didn't do it as much, and that's involving dad. But yes, dads have the same physiological connection. And that's one of the things to me that I don't think we've discussed, boasted about, whatever. But when you're breastfeeding, which allows skin-to-skin contact, or when, if you can't for some reason breastfeed or don't want to, but you still do skin-to-skin contact, strictly baby's front to mom's front or dad's front, that it increases the oxytocin in them as well.
Right.
And part of what it does, and we have some research actually beginning to show this, is that the connection, that bond, that attachment is much greater between mothers and babies. But because they also have that close time, they begin to understand each other's communication in a nonverbal way.
Sure.
And so that in the follow-ups that have been done at 1 year after birth with moms who even done kangaroo care just for an hour or 90 minutes after birth, they notice a significant difference in how mothers and babies interact and can interpret what each other is saying.
Yeah.
And significant over the mothers who didn't have the contact, who get the subtleties of what's going on. Now, Ruth Feldman in Israel has also done some work with oxytocin levels in dads throughout infancy, and her work is also showing that oxytocin level is higher. Once you get it higher, it stays a bit higher than than others. And we can increase the oxytocin level not just by holding our kids, but there's many, many triggers. Social support being one of them,
Sure.
light touch or massage, warm showers,
Yep.
and just, feeling good, a good conversation with your friend or something like that when you go back and say, oh, that was a wonderful
Right.
get together. Well, that's all due to the oxytocin, which also triggers our endorphins or the
Perfect.
opioids in our body, um, which makes you feel happier. So you want to do it again.
Highly addictive. Right.
And I think that's one of the things, with breastfeeding. If you feel good about it and it's not painful on the nipples and things, then
Right.
you want to do it again because you want to feel good. And so
Right.
why not a natural high?
Well, the positive feedback loop is brilliant because it does. It ensures your willingness and interest to make sure you dedicate the time to give to make your baby as healthy as possible. I think it's brilliant.
Right.
One of the things I always tell dads, and I relate this to the moms, is to encourage dad to do the bathing. So
Okay.
so especially with my kids, is that I would do the skin on skin, but I would
Mhm.
do the bathing, and so uh, on a number of different levels, it's great for dads because it gives us that one-on-one time that I say mom's not allowed in there. So mom, you have to go sit on the couch, have a cup of tea, do nothing, but just put your feet up and relax. But it gives dad a chance to figure out how to hold the baby and how to move the baby, get comfortable so that it's effortless, it's comfortable, and it's easy. But that skin on skin contact initially, it's you're doing the washcloth thing and you're getting used to just holding the baby and that connection, the trust, and the baby's looking at you, and it's great. But then eventually you get to that shower point where you're skin on skin, you hold the baby, and you get that trust issue, but you have that connection where you are sharing and releasing and have those hormones, and then to get the baby
Yeah.
changed and put the lotion on, it is a lot of skin and skin and touch and fine touch. And I think any person, any dad that's certainly done that and spent the time doing that has such an incredible bond, that connection with the child, that it's an obvious, it's a oh sure kind of a
Yeah.
reaction.
Um, and grandparents can get the same thing.
Absolutely, well
You know,
said.
it it doesn't take a lot of time to make that physiological connection. And that's to me what's so amazing. It isn't I get until I got into this, I don't know if I really knew how it was made, but it was something up here in the brain. But I didn't really figure that it was a literally a hormonal um, neurological
Right,
connection that brings out the protectiveness as well.
that's great. And the same hormones were involved in creating the baby.
Right,
It's setting the whole
right.
stage for it, that it's smart and logical that they would bring it back together. You'd mentioned kangaroo care, and I absolutely want to circle back into that in a minute. But other benefits in terms of the body, can you talk a little bit about the uterus itself? Because one of the things that I always talk with moms about, and they're very interested, is getting their tummy back into pre-baby status, as tight and as small as possible, and the effect that when you're nursing and the hormones that are released, its effect on allowing the contractions of the uterus to clamp down to be as small as possible, as small as its original shape. Can you talk a little bit about the interaction to the uterus as well?
I certainly, but can I go back a little bit to just to
Awesome,
talk
even
about how
better.
the oxytocin comes up
Perfect.
and increases? Oxytocin isn't very high during most of pregnancy, but as you reach the end, I mean, other than we can trigger it at any time, but the higher levels that you get really begin as labor begins because oxytocin is the hormone that allows contractions to happen. And as the oxytocin levels begin to climb during early labor, that's what begins to cause connections between the muscle fibers in our uterus so that the contractions will get stronger. And this is the beauty of going naturally, so to speak, or not having an induction, is that, the oxytocin will slowly increase and therefore the contractions slowly increase in strength. Until you get up to that transition or right before
Right.
there and pushing. And some of that increase is literally from the baby pushing down on the cervix from the inside to trigger the release of the oxytocin. Now, the other thing that's important is that's the oxytocin that's coming from our pituitary glands up here in our brains, as opposed to the exogenous oxytocin, or what comes through an IV, which doesn't have quite the same effect. So with pushing, then, you get even higher doses or pulsations, because oxytocin comes in pulses, but pulsations of oxytocin. So that after the birth, part of this wonderful high that you get, partly from the oxytocin, partly from the other hormones that it's triggered, the endorphins and things like that. And if a mother hasn't had any interventions and just really works with her body, lets the fear decrease and the anxiety decrease, they come out high and so ecstatic. It's unbelievable.
Right.
But taking the baby and putting it immediately skin to skin helps to keep the hormones high. Now, if you initiate breastfeeding soon after that, again, every time you initiate breastfeeding, you get these pulses at the beginning of breastfeeding to get milk let down. And that goes back and affects the uterus.
Perfect.
I'll get there.
You're doing great. I love it. This is awesome.
The uterus to contract. And I've literally seen even first-time moms, if they're breastfeeding frequently, i.e. at least every 2 to 3 hours, and please don't watch the clock, but that's about how frequently baby will want to feed, that uterus will decrease in size very, very quickly. And the more that uterus contracts down, the less bleeding that you'll have from the site where the placenta came off.
Right.
And it keeps working. Now, second-time moms don't tend to like that particular feeling because after you've had the first baby, then those contractions, or the afterbirth pains, as we sometimes call them, are stronger, or moms feel more. Those poor, it's kind of like stretching a rubber band. It takes a little bit more to get it to go back down in shape. But, we can prevent a lot of problems immediately after birth just by putting the infant skin to skin and allowing that infant to crawl, because they're producing enough oxytocin to contract that uterus down so that it doesn't bleed.
Oh, nice.
I experienced when I was doing my internship or clinicals with in my midwifery program. I had one mom, and man, I'll tell you, she got into this. We as midwives were kind of sitting there, but she was rocking her legs back and forth, and she was in her own space completely. And baby was born, we put her up in the chest, baby got over to the breast in no time flat. This was all before I knew what was happening. In no time flat. But the baby was suckling so hard that we ended up having to manually remove the placenta because the cervix and the uterus had clamped down. So the placenta wouldn't come out. So, it's a pretty strong thing.
Connection there, right.
Yeah, we compensate here by always giving a shot or after birth. But if you let nature take its place, most moms are not going to necessarily need that. It's a precaution we take that, we can do it, but do we really, has anybody ever compared done any research on comparing moms who get exogenous or outside Pitocin versus the moms who hold their babies and breastfeed, and how well they do?
Not to mention, but you can't do the double-blind study
right.
on a mom. Once you do one, you can't do the other. So it's like, even if we have as good a data as we can ever possibly have, it's still not a good experiment. Right. So it's as good as we can do. But again, I always go back to logic. The body is going to create a system that sustains itself and creates a mechanism in place that's going to allow for the body to deliver a baby in such a way that child's children will be ingrained with the information, the epigenetics, which we can talk about more, on how to do this. It's a self-fulfilling feedback loop building process that's going to allow for efficiency and longevity within a species.
Right.
So to think that it doesn't have an impact is illogical. I mean, if that were the case, it wouldn't be here today. We wouldn't have evolved the way we have. So.
Well, and just a little aside, one of the things I find frustrating, knowing that putting the infant skin to skin can help decrease, is that when I look at guidelines, both from the American College of Nurse Midwives and from UNICEF for safe birth, they start with moms being in an institution and figuring out they'd be able to get Methergin, as opposed to saying, there's some places where you're not going to get to an institution if they deliver up the river and up the mountain, And I had a student who literally did a teaching with native or traditional midwives, and they had no idea that just putting the infant skin to skin and having them breastfeed could help decrease the bleeding.
Trust me, there's two great pieces in there that you blew my mind on that I want to get into that I can't get into right now. I'm trying to craft and write a paper. I do not have a university setting or background, so I'm trying to get these thoughts onto paper, and I've got a student doing a lot of research for me. I don't know the direction I need to go in or the way that I need to get it done, but I would love to send you, when I finally get it crafted, it may be a very rough draft of it, but a concept paper.
Okay.
That I would truly value your feedback, especially from your position and especially from your research side of things, of the merits, the faults, of how it would better be constructed and a way that I could better present the information. But I really look forward to that conversation with you, because I've been biting my tongue not to say parts of it until I can get it down on paper so we can have a real meaningful and succinct conversation. But it's gonna light you up, I think, and I can't wait to hear some of the things you say or where you'll take the information and how it's gonna tie in every bit of what we just talked about.
Yeah. Well, and I, encourage me. I need to get a lot of what we've talked about down on paper as well, because I know I've synthesized stuff that others don't know.
Right.
And somehow, as I said, we've got to get what we know from psych into what we're practicing in healthcare.
It seems so logical, and the fact that you're absolutely right, it doesn't manifest itself into current practice, best practice, and I feel like so much of it is based on the fact that we do double-blind clinical control trials of things that you can't do double-blind clinical control trials of. You can't do a double-blind study on a mom and a baby.
Right.
So the methodology and the best gold standard isn't applicable. So the fact that it needs a different approach and protocol, and to draw in things like psychology and all these different fields to create such a more logical conversation. I think that it would be great for you to bring that up and to add that as a chapter, because it's exactly where we need to go.
Yeah, I mean, and part of it that I see is that we've fallen so in love with technology and science,
yes,
that we keep thinking we can do it better or we understand it. But the complexity of the human body and how things interact cannot be pulled apart. My newest analogy is taking a pebble and throwing it into a pond,
right,
and you see a splash and you see ripples.
Right.
That the research that we're doing is all related to the splash.
Yes.
What are the outcomes of whatever it is that we've done?
Right.
Without looking at what the outcomes are when you go with the ripples.
The ripples. Yeah, no, that's a great. I like that.
So, and I think it's as a nurse, one of the frustrations for me is that people look at, because we're more interested in the ripples many times.
Right.
But they look at it and say it's not good science, or that it doesn't.
They
won't even read it.
Right.
Yeah.
The impressive part's the splash. Right.
Yeah, and I look at some of this and I kind of go, but that's the understanding.
Right.
That's the understanding of the patient's or interpretation.
Right.
And it's like we need both.
Yes.
And even in your double-blind studies, which, I mean, the whole pyramid of evidence just drives me nuts in some respects.
I'm with you.
Because we're missing the human side so much in those studies.
It's true. And I always like to go back to, and it may not be appropriate sometimes, but to me, what's necessary at conception is necessary at birth. And a whole lot of distraction and all the technology in the world don't make it better.
It doesn't. It doesn't.
It's usually distracting and can get in the way and interfere. And as much
Right.
as we think we're taking a step forward, we're definitely taking a step, but it might not be in the direction that is the best one to be headed to long term.
I totally agree. I mean, and ACOG and some others are starting to look at it.
Right.
No,
Yeah.
let labor start on its own.
Yes. Yes.
Even if you're doing a repeat C-section, there's some real benefits by letting mom go into labor.
And there's no rush. You got hours. You got time.
Yeah.
I'm with you.
Yeah.
There's so many different things you talk about. You're fun. I will let you go tonight because you and I are going to talk again. We have so many.
All right.
You make my mind melt with just where these conversations are going. You're fun. You're fun.
Well, and what I've come to appreciate is somebody's got to push the edge.
Yeah.
And so I think that's where I'm at is,
awesome.
That sort of a pioneer saying, wait a minute, let's look at things differently.
I will walk that edge with you any day because it's exactly, I look at my daughters. I have 3 of them. And I look at them and I want to create an environment where what I did with my wife is the norm, not the abnorm. And we're completely the abnorm today.
Right now.
And I look forward to the day that their hope and goal is to do exactly what we did because they understand the benefit, the value, and the meaning of what it is we did to have natural, normal childbirths in a relaxed tub setting, warm water, connectivity, touch, just allowed it to be the way it's supposed to be. So
ended up as a single mom, as a single person deciding to adopt was because I appreciated so much what my parents had given me.
Yes. I can see that. And the fact that you passed that along and did the holding, you rewired and resynaptic. That whole neuroplasticity thing is beautiful. And the fact that you knew to do that is huge. I would almost encourage you to write even an ebook on adoption of the mechanisms involved from the neural connection, and when you're meeting this child, what kind of bond do you want your child to have? What do you wish for this child's life? And the best ways you can possibly make it happen. This is what happens in the brain. This is what's critical. This is what's happening because of the process of separation. And here's how you can mend it as best as possible. I don't think there's a person doing an adoption that wouldn't want to read that.
Well, yeah. I mean, and that's a community that I keep thinking you guys have, social workers and everybody in the adoption community's got to realize that the more holding and if they can get to the skin to skin, particularly early on, the healing that will occur.
Absolutely. Yeah. And
it's just huge.
You allowed that opportunity. You're great. That's great. I would love to see that. I'm serious. I think that book alone would be so beneficial, if not just an obvious win for you and a win for parents, but I would love to see it for the kids. I think that it would make such a big difference in their lives, and I think that's very valuable and meaningful. You've done a great job and continue the great work.
Thank you.
Thank you. On behalf of the Childbirth Summit, I'm Dr. Rob Coombs. Get well soon. Well done. You did great.
Thank you.
That's
going to have to be more than one segment, isn't it?
It's probably going to be 2. It's going to be great. But trust me, there's 2 great pieces in there that you blew my mind on that I want to get into that I can't get into right now. I'm trying to craft and write a paper. I do not have a university setting or background, so I'm trying to get these thoughts onto paper, and I've got a student doing a lot of research for me. I don't know the direction I need to go in or the way that I need to get it done, but I would love to send you, when I finally get it crafted, it may be a very rough draft of it, but a concept paper.
Okay.
That I would truly value your feedback, especially from your position and especially from your research side of things, of the merits, the faults, of how it would better be constructed and a way that I could better present the information. But I really look forward to that conversation with you because I've been biting my tongue not to say parts of it until I can get it down on paper so we can have a real meaningful and succinct conversation. But
Well,
it's gonna light you up, I think, and I can't wait to hear some of the things you say or where you'll take the information and how it's gonna tie in every bit of what we just talked about.
yeah. Well, and I, encourage me. I need to get this, a lot of what we've talked about, down on paper as well, because I know I've synthesized stuff that others don't know.
Right.
And somehow, as I said, we've got to get what we know from psych into what we're practicing in healthcare.
It seems so logical, and the fact that you're absolutely right, it doesn't manifest itself into current practice, best practice, and I feel like so much of it is based on the fact that we do double-blind clinical control trials of things that you can't do double-blind clinical control trials of. You can't do a double-blind study on a mom and a baby.
Right,
So the methodology and the best gold standard isn't applicable. So the fact that it needs a different approach and protocol, and to draw in things like psychology and all these different fields to create such a more logical conversation. I think that it would be great for you to bring that up and to add that as a chapter, because it's exactly where we need to go.
Yeah, I mean, and part of it that I see is that we've fallen so in love with technology and science
Yes.
that we keep thinking we can do it better or we understand it. But the complexity of the human body and how things interact cannot be pulled apart. My newest analogy is taking a pebble and throwing it into a pond,
Right.
and you see a splash and you see ripples.
Right.
That the research that we're doing is all related to the splash.
Yes.
What are the outcomes of whatever it is that we've done?
Right.
Without looking at what the outcomes are when you go with